Hi, my name is Ambrazo. I'm the founder of MPN Advocacy and Education International. We are celebrating our 13th or 14th year. I can never remember. Isn't that crazy? But have started a lot of different initiatives, one of which is pediatric and young adult MPN programs. And with me today are two young adults who have had an MPN or were recently diagnosed. Some of you may recognize Cam. He's a part of our patient advisory council and he has spoken at some of our events in the past. And then we have with us Siobhani, who is going to share her story first. And for all of those young people out there, this is really important that you hear from them. And for the generation above them or older than them, how young people are dealing with their diagnosis. So please welcome Siobhani, and Cam and I will be back. We can't hear you, Siobhani.
Oh, apologies for that. I was speaking on mute. And thank you so much for the introduction. Hello to everyone on the line. My name is Siobhani, and happy to kind of chat through my diagnosis first, and then dive a little bit deeper into how I've been managing living with an MPN and how it's kind of affected my life. So, starting out, um, a couple years ago, when I went to my annual primary care visit, I got my blood work done as I normally do. And my CBC panel showed that like my platelet count was consistently really high. And initially, my primary care physician was like, "Oh, this could just be a fluke. It could be an infection, something else, a cold maybe." And she was like, "Just come back in a week or so, and we can see if your levels remain consistent. And if not, we can go from there." And my levels were around in like the 800 range for the platelet count. So I came back in a week or so, got my blood work done again. And at this point, my levels were in like the 1 million range for platelets, which is pretty high. And she was like, this is still a little bit abnormal. Let's give it like a couple weeks from today. And you come back again for blood work. And if that doesn't work, we can send you to a hematologist. So I did just that. My levels remained in like the 1 million range. And from there, my primary care physician, who's fantastic, was like, "I think you really need to go see a hematologist." And at this point, I'd never seen a hematologist before. My parents were a little bit freaked out because hematologists often have the title oncologist as well. So they were like, "I don't know why you're seeing a hematologist oncologist." And we're already a little bit apprehensive. Um, but I went to a hematologist. I got like a full blood panel done. I got like genetic testing done as well. And I didn't have any of the normal mutations that you have for an MPN. I was negative for JAK2 and CalR. But my levels for platelets were still consistently high, and my iron levels initially were a little bit low. So the hematologist, seeing that like I was a fairly young patient and otherwise really healthy, initially thought that my diagnosis could just be an iron deficiency. And so he ordered for me to get an iron infusion done. And so that's what I ended up doing. And we did a series of iron infusions over a couple of months, and my platelet levels still remained at the 1 million range. And he was like, I'm not really sure what could be causing this. And it might just be that like you have to supplement this with like taking daily iron as well. Um, and as I continued to do lab work, my platelets still remained in the 1 million range. And at that point, I was a little bit freaked out myself. Um, and I decided to go to another hematologist. And then when I went to this hematologist, I came with all the lab work I had from my primary care physician, all the lab work I had from my previous hematologist. And I was asked to basically go through all of the lab work again. And then this hematologist was like, this may be something with your platelet levels consistently being high over the last 4 months or so. This may be something deeper at play. would you be open to doing a bone marrow biopsy? Which initially to me, like I've had no surgeries or any outpatient procedures or anything like that. I was like, I don't know that I want to do a bone marrow biopsy. And to me, I was still feeling perfectly fine throughout all of this. Like it had very little impact on my day-to-day life. I felt really no symptoms. So I was kind of hesitant towards doing that. And I was like, let's wait a couple months or so. And if my levels remain consistent, like maybe I would be open to doing a bone marrow biopsy, but that seems kind of extreme. And this hematologist, she was like, in the meantime, I do want you to be taking daily aspirin because your levels of platelets are quite high. And I'm not sure that that level being above 1 million consistently is like safe for you to go about your day-to-day life and for us to have basically no intervention. So I started on the daily baby aspirin, 81 milligrams, and basically just did nothing in the meantime. But as seen before, my levels continued to remain really high. And I discussed my care with my primary care physician as well as with my parents, and we decided to go for the bone marrow biopsy. And as I've heard before, like an MPN is definitely a condition that is an exclusionary one. So once everything else has been ruled out, once it was not an infection or something that was secondary, or once it was clearly ruled out that the iron deficiency wasn't what was causing my platelets to consistently be high, and it came from my bone marrow biopsy that there was obvious scarring of my bone marrow tissue, and there was clearly something that was going on there directly in my bone marrow that was resulting in my platelets to be high. That my hematologist, my second hematologist, finally said, I think there's something deeper at play. I think you might have something called an MPN. And she did a really good job of explaining that. My mom, who's wonderful, comes to all of the appointments with me. And I remember her just like freezing and like almost like silently sobbing in that moment as she heard that um, the condition that the hematologist thought I had, the triple negative essential thrombocythemia, is technically classified as a cancer. Like my mom obviously was really freaking out. Um, but then this hematologist was also working with me and she was like, this is not like 100% confirmed. I would like you to go to Georgetown. I'm in the DC area and confirm this diagnosis with a specialist in the area, Dr. Kessler. And once that's confirmed, we can go about your treatment plan. But since you have no other symptoms, since the daily aspirin seems to be working, like in the current term, there's nothing else that's required. So from there, I felt like to me, I hadn't quite processed that I may have this condition. Again, like I felt very normal throughout my day to day. It was only that like my platelet counts were high, but if you looked at my life, there was no other impact that this condition had really had on me. And I almost couldn't even believe that it could be something that was so extreme. Um, so after I went to my first appointment with Dr. Kessler, he reviewed all of my previous lab work. He reviewed my bone marrow biopsy. He reviewed the genetic testing I done. He was the one who finally was like, I think you have a triple negative case of ET. And this was about 2 years ago at this point. And then since then, I've been mainly in a maintenance phase where I go and see him every month or so. But I've also had no symptoms, and luckily none of the side effects that comes with having ET. And my levels with taking the aspirin have consistently been around the 700 to 800,000 level. Um, but yes, definitely the initial part of getting diagnosed, as well as having doctors basically even come to the diagnosis of MPN, I felt like was quite difficult because this is a condition that is quite rare, especially in young patients, and is not a conclusion that doctors and physicians come to quite easily. And I'm super fortunate that living in the DC area, I had a lot of people in my corner that were willing to help me out, as well as a wonderful MPN specialist that I now see that knows a ton about the condition. But that is pretty much my story. Happy to open it up to any questions.
Well, we really don't open this up to questions from the people watching, but I have a few things I want to say to you. First of all, you explained this so well. Thank you very much. And you are absolutely right that you really do go through a process of elimination when a person is diagnosed, and sometimes it's missed.
Mhm.
So I have to say bravo to your primary care physician and to the hematologist. Switching hematologist was a brave thing on your part. We happen to love Dr. Kessler. He's done a lot of work for us. We've worked with him in the past, and he's one of the best. So, I'm glad you were able to get to Georgetown and see him. And we're just pleased that you were able to share that and that you're doing so well. That's really great. I'm very happy to hear that. And so we're going to say goodbye to you just for the moment and let Cam come on. Hi, Cam.
How's it?
And as I said earlier, Cam's been with us before. He's in our patient advisory council, and I think Siobhani's going to join Cam in helping you oversee kind of the young adult groups and
Mhm.
start doing some of those, and we'll help you with that as we go along. But we'll hear from Cam right now. Cam has shared his story before, but it's worth listening to, and we'll see you in a bit.
All right. Well, yep, that's appreciate the introduction and Shivani for sharing. It's always insightful to hear from other perspectives and why this is so powerful to begin with, is everyone has their story and experience, and it's helpful with someone with an MPN to hear and just feel heard and understood, I think is the biggest thing with this kind of invisible behind the scenes um, disorder. So my story is pretty interesting now that I'm 8 years into it and I'm no longer a young adult. I'm an adult living a real world in the real world and looking to build the next chapters of my life and really, develop and think about all the things that everyone thinks about when they're 25, going on 26, despite having something behind the scenes. But I feel like it's something of note that being 8 years in, you forget what you were like pre-diagnosis. So when I think about it, pre-diagnosis, you never think when you're sitting at home eating dinner. I was a runner going on my runs that I would have something going on in my bone marrow in my body, that something was off. But interestingly, I did always have floaters in my eyes. I did always have headaches growing up, and that was always attested to lack of hydration and things of that nature. But it's interesting to see the pre and post diagnosis feelings. So I was 17, senior year of high school, was a track runner, and I hurt my leg pretty bad. And it was just by coincidence that my mom had me go to get my leg checked. And the orthopedist actually was the one who was like, "Hey, your blood counts, we had it ran, found out that my platelets were elevated. Could have been an infection, similar story to most people that end up finding out." And it was off. So we ended up going to the hematologist, and he was like, "Yeah, you need some testing." So went through all the good stuff, all the testing, and turns out that I was Jack2 positive, and that threw a wrench in what my plans were when it came down to being on the precipice of college, being excited to move out of my home, be a few hours away from home, living on my own, getting to that next stage of life. And as a young adult, and for all the teenagers, like there's so many things on your mind, and health, thankfully for, so many people isn't a problem being a young kid. And it's not anything you want to think about. So that was kind of my mindset, is I found out about it. And of course, my mom was devastated, and I was very shocked and confused at being told that I have something wrong with me, per se. But I took it at face value as, hey, this is what it is, and I'm going to make the most of life and, appreciate what we do have instead of looking at what we don't. So that was the biggest takeaway for me right off the bat, is being diagnosed that, hey, this sounds like it's going to be manageable, that it could be mediated, that there's going to be a lot of support. I know my mom's always going to be here for me, so it's going to be okay. But of course, that's easier said than done in the moment. Very confusing, very difficult to hear those words, that it is a cancer. That is what's, I think, the hardest thing with dealing with this invisible disease is you look and feel normal for the most part, as opposed to, some heavy duty problems that people could have. But in my case, I just wanted to be normal. And I think that's what everyone feels like. You don't want to be excluded. You don't want to be feeling like you're on the outside. You don't want to be left out, especially in those younger years where you're in high school and in college. You want to attend the social events. You want to be able to stay up late and go on trips and play all the sports that you do and go to classes, be locked in for your exams and all that good stuff. But sometimes the symptoms are there. I had bad fatigue. I was always exhausted. I'll never forget freshman year. I went to school diagnosed in August. I had to get my bone marrow biopsy, and it was a horrible experience for me. I was 18. They actually messed up at the time, and it hurt pretty bad. Uh, and I had to go to college a couple weeks later, and my mom didn't want me to go. So it was overwhelming. But when I got there, I wanted to do the most for me and just be an 18-year-old guy who loves meeting new people and experiencing life. So what I did was I went to the gym 6 days a week, made sure to run to the gym every day. I was eating like a cow. I was, eating 2 burgers, 2 chicken sandwiches. I was just making the most of building up energy and not sulking by any means. Definitely taking my mind off of it. And that's the argument to be had, is taking too much time off of thinking about it, because it is important. You do need to monitor your symptoms. You should journal. You should take care of your health. You should be conscious of your diet. You should be conscious of your sleep patterns. And my story is definitely one that, looking retrospectively, that is something that I would definitely say to do, is to make sure that you're on top of your health, because as much as you want to make it invisible because it feels invisible, it isn't. And it's something that's important and you can't be negligent about. And I think that's the biggest takeaway as a 25-year-old now, looking back. I did have progression. So 18 years old, I was diagnosed with ET. 20 years old, a couple years later, I was getting phlebotomized about every 2 months. So definitely was getting phlebotomized pretty consistently, was taking a baby aspirin, but my platelets were consistently over 1 million for the most part, and my hematocrit was too high. So I was low on iron, so felt the fatigue, had the headaches. That was primarily my symptoms in college. So when I went back, my Dr. Mascarenas at Mount Sinai in the city in New York said, I think you're actually progressing. And he said, I actually have PV, which didn't really change anything at the time. We brought up the ideas of treatment, but I was a 20-year-old who was in good shape, and I thought it would be silly of me to go on medication. So this is all about monitoring and paying attention to your body and the numbers. And that's all it was for me, is monitoring numbers, monitoring symptoms. And they fluctuate, and floaters, some itching after the shower, fatigue, headaches were really my main symptoms, night sweats, and they were all manageable. And most people that talked to me if you walked up to me on the side of the road, would never know that I had these symptoms. But at the same time, as someone experiencing them, I never felt that it was worthy to talk about or easy to talk about. So in a social environment, it was extremely difficult, even to this day, to talk about it, because it is so difficult conceptually for people to understand that you have cancer, but it is low risk and it is managed and monitored, and that you are normal for the most part, even though you're not. And I always battle myself with that concept. It's the hardest part, I think, of having an MPN and having these kind of panels and discussions and support groups and doctors speak is really what helped me grasp it and take it by the horns and understand, like, this is going to be a ride for life, and I could either make the most of it or make the worst of it. So I'm going to consciously continue to make the most of it. So through college, I had PV. Numbers were pretty static, around 1 million platelets. All the symptoms were about static. And then I was able to graduate went through COVID during this, so that was a little scary, especially for my mom, who was worried about, how that would interact with PV and so on. Uh, Never ended up having COVID, but graduated, went home, and we moved down to North Carolina, and that was around 2022. So about 5 years into the journey, for lack of a better word, and I started to progress a little bit worse because I was less socially active. I was, not getting a lot of sunlight. I was working remotely. I think a big thing about this is keeping on top of your mental health and making sure that you are doing things that everyone else is doing, that you are a part of groups, that you are going out socially, that you do go to the gym, that you do go on morning walks, that you meditate or journal. Because when you don't, that's when you really feel like, oh, I have something wrong with me. That's when you feel it the most, when you're not acting as though you're okay, while still being cognizant that there is something wrong with your body. If you make the most of it, if you go to the gym, if you're seeing friends for coffee, if you're going to lunches, you're gonna feel better mentally, which also makes you feel better physically. However, I neglected that, and in a year and a half of North Carolina, I gained weight. I was exhausted all the time. I had no energy. I was, like basically depressed, and the numbers were showing through that. And my numbers were worse. My spleen was enlarged. I just didn't feel good. I didn't feel like myself. And towards the latter end of that, there was some heavy discussions about going on treatment. And eventually, after pushback and trying to not go on medication, fast forward to 2024, I hit a turning point in my life where I didn't want to be down in the dumps. And I said, I'm going to move back to New York because I'm an adult. I can't do remote work anymore. I want to be in an office. I want to be by my friends. I want to have some social life. And turning that around and returning to that social life and having an in-person job and taking care of myself, I did feel better. But at that point, the numbers were the numbers. And that was due to a lack of monitoring and taking care of myself. And so I ended up starting Best Remy in August of 2024 because my platelets were 1.4 million. My spleen was extremely enlarged. Um, so it was very discomforting and it needed to be treated. And since then, I actually pulled up my numbers before this. My platelets have descended from in the millions to down to 250. My white blood counts have been cut in half. And all in all, I feel a lot better. But again, it's the mental turmoil of I have a journey that is never going away. There's no stop, and it's just keep on going and making the most of it and relying on your support systems, whether that's medically, family, relationships, and understanding that you always got to look on the bright side and never look at the gray clouds because there's always something out there that's worse. And you got to be thankful for what you do have. And even with Best Remy, there is some negatives to being on treatment, and I was terrified of being on treatment or medication. But after being on it, despite the side effects, mainly for me itching, I'm still thankful that I am on it, even though I do complain to my mom about how I don't want to be on medication, and I do have the frustrations that everyone does. I understand that it's what I need to do, and I take a deep breath, and I'm just, again, grateful that I am preventing the development, that I am monitoring my symptoms, and that I'm going to be okay and live a long and happy life. And just looking forward to continuing forward.
Cam, you amaze me all the time. And, you said so many things that resonated with me and I'm sure with other patients. And the main things are the mental health piece, which is so extraordinarily important. And I do have a person in my family with a blood cancer who I just saw recently, and I can tell that his mental health is not real great right now. And because he was told the blood cancer he had was going to be fine, and he was fine, and he's not. And so, and I also love that you said this invisible cancer. And yes, it is invisible. And so, we have patients, and Siobhani, you could probably, attest to this as well. And, the idea we heard from the moms the other day, and And one of them was saying, I don't know if it was your mom, Cam, or Sylvia, who said, you know, their child was not feeling well, but the friends didn't understand that they had this cancer and that they had to, you know, they had certain things that were not going to be they days that were they were not going to be feeling okay, and just the misunderstanding about the cancer. Um, Also, that was something that was mentioned was hydration. And I've been reading a lot about hydration lately, and that was mentioned also the other day by one of our doctors. It's really important for MPN patients to stay very hydrated, always drink water, always have water available. Um, the exercise, as you two know, fatigue can be, you know, the biggest problem with our patients. And but even walking to a mailbox or something, just doing something, getting up and moving. I loved what you said about staying social. Now, not everybody's a social person. You know, some people have to force themselves to be in a room with a couple people or to make friends and all of those things. But there are studies, not necessarily about MPNs, but studies just in general that talk about having having a social life of some sort. They are studies that show that people that live in cities tend to live longer because they have to walk places, they have to talk to people, they have to be around people versus those that have to get in a car every day. And so so many things. And your doctor, Dr. Mascarenas, has also been one of our partners and has done some work with us before. He's a great guy. So you're both seeing really good MPN specialists. For those people that cannot always see an MPN specialist, there, if you see your primary or your the hematologist in your area, perhaps maybe once a year you could see an MPN specialist and share that information. It's very important. So before we leave, you know, you both are terrific people. I just can't say enough. And I so appreciate you sharing with everybody. And we will be sending this out, I think, on Thursday. And so what wisdom would you impart? Although you both said some really great things, is there any last word or last message that you'd like to share with our audience? Cam, do you want to go first and then Siobhani?
Yeah, I guess it is collectively what we touched on, like you just mentioned. I think acceptance, it takes time, and you have to be patient with yourself and the people around you. And when you do accept it, take it at face value and make the most of it. And I think that comes with taking care of yourself in all facets. So whether it's focusing on one of your goals in life and being productive, or going outside, as simple as a 5-minute walk, or just forcing, I need to be better at this myself, but forcing yourself to have an apple once in a while, literally anything, to smile a little more and just feel it as though you're not just some sick person or kid, because that's not what you are. Don't identify yourself as that.
Fantastic. Siobhani?
I don't know if I can beat Cam there. But I think for me, the biggest thing was know that you are in charge of your own care. No one can be in your own head or be in your own body and understand what you're going through. I think in my case, I was the one who pushed and was like, we need to go to a second hematologist. I feel like with my levels being consistently high, it's not just the iron. Especially as a younger patient and with how rare MPNs are, just remember you are in charge of your own care. If something feels wrong, don't be afraid to get a second opinion or reach out to another hematologist or reach out to an MPN specialist. Like in the world of telehealth, there's so much that's available to you.
Excellent, excellent, excellent. Thank you both so much. I will be in very close touch soon because we need to start having these conversations more
Mhm.
and with other younger people. And but you know, I'm very proud of both of you, and you're just something else. You always, every time I hear from any younger person who's going through this, it just incentivizes me more to do more. Thank you.
Thank you.
Thank you so much.
You're welcome, sweetie.